Again, I apologize for the delay in starting our 12 o'clock meeting. We do have to have a quorum to call the meeting to order. First, I'd like to start out and provide an available time for anybody to disclose any conflict of interest that they may have. Seeing none, I'll move to the next item, the mission statement. Mr. Lester, would you mind reading our mission statement?
To improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you. Next item is public comment. Okay, Ms. Lester said there's no public comment at this time. If everyone has had an opportunity to review the minutes from our December 9th meeting, I would like to see if anybody has any question or additions to add, and if not, I'll call for a motion.
Move to approve the minutes.
Second.
Second. Is there any question or discussion? If not, all in favor? Aye. Motion passes. Next item on the agenda will be the CEO performance goals. So we have these broken down into A, B, and C. A being the fiscal year 24, which encompasses the time frame of July 1st, 2023 to June 30th, 2024. B, fiscal year 25, July 1st, 2024 to June 30th, 2025. And then third, C, which is the contract discussion, as Dr. Webb's current contract expires June 30th, 2025. So on part A, I'd like to start out from our last meeting. We had a healthy discussion with also comments from executive leadership team to go through the prior performance goals, and had each individual that had a head of line of business for the hospital kind of review these different key areas. And so we appreciate their time. What I'd like to do today in specific relation to this fiscal year 2024 evaluation is actually with respect to our time is to table this discussion. There's some things that I feel like I would like to have the opportunity to review directly with Dr. Webb that specifically would be helpful in my personal evaluation of the metrics and being able to therefore score him appropriately. I don't know about other members of the committee how you feel about this, but personally I would prefer to do that. The other reason for my hesitancy to go ahead and finalize this is we have had a new member of this committee appointed, David Escoval, and since he has not had an opportunity really to take time and review the information, ask questions, and to dive a little deeper into the metrics, I think it would be respectful of his opportunity to vote accurately and to score accurately. So if any of the committee members have any thoughts on this, I would welcome them.
No objection for me. I support that.
Well, and as a new member of the committee, I really appreciate that, the opportunity to get up to speed and have already an orientation session as a relatively new hospital authority board member scheduled with Dr. Webb on Wednesday. So I too would appreciate the chance to talk with him and get his input. So that would I appreciate that, and I support that plan.
Thank you so much. I appreciate both of your feedback. So we'll put a hold on the discussion. Oh, I'm sorry. Excuse me.
I would recommend not using the word table.
Okay.
I would recommend we postpone the evaluation until the next scheduled committee meeting.
Duly noted.
Tabling something can kill a matter.
Yes.
And
sorry for
I don't think that's the actual intent.
Inaccuracy in verbiage. I appreciate your input, Derek. So we will postpone this discussion and final scoring. So I appreciate that. Probably should have taken some law classes.
Remember parts of it.
I appreciate that. Thank you so much. And I have asked Derek to be here as representative of Metro Legal to make sure that we are operate appropriately if I want to be able to postpone things like this. So I appreciate that. We will then move on to fiscal year 2025. So in your packets, you will see some of the information which I had referenced trying to obtain in our last meeting in December. And so just felt like I wanted to walk through some of this, not in detail, but just as a reference point to building out what our committee would like to see going forward in fiscal year 2025 for the CEO metrics. As stated prior, I think this is a very important committee. It is one that I think historically has used a similar format year over year, and I feel like it is important to, periodically to go back and make sure that we are using best practices and the format in which we had previously used still makes sense. So if there's any evolution of that, I think it makes sense to do some due diligence. I welcomed committee members to, if they have reference material, to provide that to Ms. Lester or myself so we could get that distributed to the committee. But again, this is nothing I handed out is not public information. The CEO metrics Gmail attachment actually came from an individual who was a CEO of a publicly traded hospital here in Nashville, but had actually worked in as well with an index hospital. So I felt like those comments might be helpful in, again, part of our discussion. So you will see that first. You will also see some information from the Nashville Electric Service, as well as BNA, the Nashville International Airport. I provided some, most of the detail that they have specifically with BNA, since that has been my history in working on that board. And so I thought that would be helpful. Has our committee had a chance to review that? If not, again, I know, you received this fairly recently, but just wanted to hit pause and see if you have any questions or anything else that you'd like to make sure that we have available as we move forward with the new goals.
May I ask a question? So I see the metrics email and then the specific airport authority, and there appears to be a lot of overlap, a rough division of financial accountability measures versus operational accountability measures. I could see how some of the operational categories would translate over to the hospital authority. What is the structure that is in place for the period that has already passed through fiscal year 2024? Is there a set of metrics like this that is in existence, and if so, where do I go to see that?
You're referring to, is there a set here at NGH?
Correct. Are we measuring, when we're doing the performance evaluation through June 30, 2024, are we measuring that against an objective set of criteria like we are considering for 2025?
I haven't seen it presented specific to this format. The other thing that I have in meeting with BNA executives is they have been able to provide a fiscal year projection on a multiple year format, which I'm not sure that we have here at this point, or I don't know that I've seen. One thing I didn't want to do is, I guess I feel like, let me say this. One thing I think that would be helpful is if we have things like this that we would like to obtain, I would ask Ms. Lester to make a note of those. And as a follow-up, and I think this would be Mr. Narramore's area of expertise, but be able to provide that. So just clarify the specifics of what we would want, and then we can have that distributed.
Madam Chair, we might want to add, for David's sake, some of the background that led us to why we were kind of starting from scratch. Because for a number of years, there was not a very specific board assessment. And so we took it upon ourselves to begin that process, to be able to catch up.
I see.
Because we didn't think it was fair for the hospital, for the incumbent, to not address the annual performance review on a regular and routine basis. So to answer, I think, your original question, we kind of were starting from scratch in putting together a set of criteria. And as we have moved along with the addition of the material the chair is providing, we're trying to refine that so that we get even better and more current and up to date. Is that?
It makes sense. Yeah, I think I understand. So starting from scratch is that there's not a set of objective KPIs, things that are in the BNA CEO evaluation that we have in place. This committee is going to develop those and apply those.
Well, you mean in NGH's standpoint. So one of the, I think, important pieces that I gathered when I met with the CEO and COO is that these criteria were actually derived from their work, not our work. And additionally, it's been vetted through third parties, and so those third parties have supported those metrics to make sure that they were reasonable, maybe even a stretch. And I do think that that third party validation on 2 or 3 different accounts is helpful, rather than either us as a committee deciding, since that's not what we do every day, right. And then 2, it's not incumbent only upon the executive leadership team to come up with goals and then say, oh yeah, we did a great job at our goals. So, yeah. Again, kind of from an audit perspective, is like, hey, let's come up with this. Let's create very definitive goals, and then let's validate that through third parties to make sure that they're accurate, effective, or stretch, and then have the reporting back to us.
And if I might just add that I think when we looked at what did exist here, we weren't satisfied that it accurately described what we felt was the appropriate measures. So it led us to, okay, we have to look a little deeper into this, because that's not the way it should be.
Okay, good. Thank you. That's helpful, and I appreciate your catching me up on what the committee's charge is and what we're doing. Thank you.
And, furthermore, I think that as these metrics are established, that helps provide a natural glide path for executive leaders, people who are responsible for certain lines of business, to be able to directly impact a specific subject and measurement criteria. And that will help further define and hold those individuals accountable to the success of that one target area that they're engaged with. So it is a glide path from here's our metrics and here's what we agree on, ultimately are graded on, to this, let's say specifically at the COO level, et cetera, VPHR, here's how it directly impacts the organization. And so I think that will be all the way down. I think that will help with the critical objectives for each entity.
Yeah, I mean, it ended up being kind of 3 phases. Looking backwards, which some of us weren't even here for, that era of assessment, then getting it to be current so that we could at least catch up, but to the greater piece that the chair is, I think, directing us and providing material to look at really defining this for future assessments so that we can be right on target.
Yeah, I think that there seemed to be less metrics. There was a 2-year lag in providing the criteria to the CEO in the past. So as I've stated to Dr. Webb, that, and I think our committee said before, it's a disservice to him or anybody who sits in that seat to be expected to excel. I mean, much less meet, right? Meet, but excel in goals if you don't know what those are, and they're not only set after the fact, they're approved after the fact. So I do think that regardless of whether he achieved a high level of success or not, giving somebody goals after the fact. Now, I just want to change that. And so that's the goal of trying to be timely, number one. 2, create the right committee. 3, evaluate what we have done in the past, is that something we even should be using, and does that make sense? And then how do we specifically identify metrics that will help us evaluate? So, as an example, I do know that there are different ways that, whether it's a metro government entity, whether it is an authority, they've handled their reviews very differently. It doesn't seem to be there's a consistent way or a quote-unquote right way to do this. So, as I'd stated also, I think to Dr. Webb, I said, look, we're not comparing apples to apples, but we're not comparing apples to automobiles here. Maybe apples to oranges to maybe a cantaloupe, but I do feel like it makes sense to, sorry for all my random analogies. I like the fruit, or I like the fruit. But we're trying to create a space that allows us to be comfortable, evaluate, and be ultimately transparent. I think that's what I feel like would be a good help. The CEO of NES was also kind to provide the outline that she is graded on. Their processes is different than BNA's, which is also different than this other grading criteria, which seemed to, I'd gotten this other criteria for Metro specifically, and I think some Metro organizations use this specific, the last page here, that's the assessment of key accountabilities pages. That is some of the Metro entities. Derek, are you aware of anything that would be helpful for us to know? I'm not sure, and I hate to put you on the spot, but it may be something that you need to follow up on. Are you aware of anything that would be helpful for us in either obtaining data or being for our objectives here?
I'm not aware of anything. These outside entities, such as NES, Metro Legal doesn't have a legal role with those entities. Other boards and commissions that we do work with, there's no set standard because they all have different missions, and they are administrative bodies that function a little bit differently than the hospital authority. So I really can't be a source for guidance of their CEO or executive director performance evaluations.
Yeah, that's very
Going
fair.
back to your analogies, it would not be comparing a fruit to a similar fruit. It would be a fruit to automobiles character.
Sorry. I like fruit. Okay. So as we are considering whether or not to use a similar format, I had hoped that this would move a little faster, but obviously it feels like it's going to take a little bit more time. And I'm glad we have some, while you're not acting in a legal capacity, we have to do some legal expertise with regard to contracts and being able to navigate that process. I appreciate you leaning in and be willing to help with this, David. So is it, I guess maybe more of a conversation, is it each of your idea that we would use the current formatting structure with 2025 and then expand on that? Or do you think we should use something completely separate and come up with things more, whether it be like the airport, like the NES, like any other entities? I mean, what is your thought on that?
You go first. 'Cause
I think we've done some work that leads us to a base. I think we can investigate the additional information that we have. I don't want to go back on the fiscal year 24.
Yes.
I think we've made an attempt to look at that, and I think we should be satisfied with that and move ahead. I think where we are now is to take a little bit more time on 25, but keeping in mind that 25 is, 2/3 of the way done, or at least halfway done. And I don't want to make major changes for half of a year. I don't think that would be appropriate for the executive. But I do think the next phase would be how we look at this for 26 and beyond. And that's where this material, I think, is very helpful. So I would be satisfied taking what we have and moving ahead on fiscal year 24 and fiscal year 25. That being said, the work, I think, would be to make sure that by the end of this fiscal year, we can present to the CEO what his goals and assessments are for fiscal 26, being comfortable that we've done proper investigation, engaged any additional information on top of what we have already done. And if that is satisfactory, then we have the basis for moving forward, and we've caught up with where the board needs to be with its assessment of the CEO on a timely basis.
Thank you for those comments. David?
That makes sense to me. I'm very new to the process, but I think the idea that a fiscal year that has already ended as of June 2024, it's not really appropriate to then start creating metrics to a period that is long since over. I would be open to the idea that in this current fiscal year that is not yet done, that it may be a hybrid. There are some things where it would not be appropriate. I don't know what it would be, but I would be open to the idea that there may be criteria that are appropriate to include as part of the evaluation that will take place at the end of 2025. I say that completely theoretically. Maybe there isn't anything that falls into that category. But largely, I agree, we're in the middle of a fiscal year and sort of tinkering around with what the expectations are for performance. That's the ground for evaluation. We ought to be very cautious about that.
I would agree. I think we've tinkered some. And I think, to me, that satisfies what we need to do for the current fiscal year. My emphasis now moving forward would be, how do we clean it up so that beginning July 1st, it's clear to everybody, both the board and the executive, what these goals, what these assessment criteria happen to be.
I think the chair spoke to that earlier, and it sounds like we are all in agreement that it is a fair process would require everybody knowing what the expectations are ahead of time. So rules are in place before the game starts. It's not a game, but you see the analogy that I'm making, and so that seems right. I guess I would also add to that I wouldn't want to lose sight of the fact that the specific criteria and metrics, when I look at the airport's evaluation, I mean, it is a lot of it is very specific and objective, which I think is a great thing, and it's verified by third parties. There is also there are performance expectations that don't need to necessarily be articulated in percentages and, percentages of operating revenue. Those are all great metrics, but I would think as a committee, we would also, given that we don't have the specificity that we'd like right now, we don't abandon the idea that we can also evaluate performance even if we don't have specific criteria right now. So I would just note that that's there's some common understanding, and I think there's some basis to evaluate, even if don't have all of the tools that we'd like to have.
Thank you both for the comments. And so looking at the fiscal year 2025, I know we had, Craig, you and I had been on this committee, I think, with Michelle Gaskin-Brown before, and we had talked about some evolution of the metrics. Is it, just so I hear you correctly, is it your recommendation that we keep those also for fiscal year 25, use the same evolution metrics without changing those at this point?
I would prefer to not make major changes, or frankly, any changes at this point. I think, to David's point, there are items that can be discussed under as subtopics that may or may not be necessarily objective, because not everything is objective. Not all of the points are objective. Not everything is in dollars and cents. Some things are more tonal in quality. And I think those are things that we are capable of assessing underneath the current set of criteria.
Okay. That sounds reasonable. I think that is a fair way to handle the fiscal year 2025 goals. I know that on the minutes we had made some, I think a minor change to where we would house certain goals. So I'm not sure if those had been made, but we want to make sure that those are defined in the appropriate categories. I do think it behooves us to go through the categories, and we don't have to hammer this out here, again, especially since David is newer to the committee, but I do think before our next committee, we should each use the fiscal year 25 criteria, go through there, and make sure that if there are any metrics we do want to have tied to the objectives, that we go ahead and consider what those might be. Let's get those outlined and defined for fiscal year 25. And I think that will help us be able to kind of finalize that criteria by hopefully the end of the next meeting. Is that a fair goal?
It is.
Okay. Anything else on fiscal year 25? Okay. We will move on now to contract discussions and the review. Go ahead, I'm sorry.
Madam Chair,
Yes, sir.
Just for clarification. So are we going to now make a recommendation to the board regarding the fiscal year 24 assessment?
The answer is I would prefer at this point, because I think based on my understanding of our last meeting, we were planning on finalizing that score and then making that recommendation to the board. Based on my earlier comment, I would prefer, because I don't feel comfortable yet finalizing my scores yet. For Dr. Webb, I'm requesting a meeting through Janet, so I have an opportunity to chat with him personally, and then that will give me more comfort in finalizing my score.
Okay.
And then we can also finalize that, I think, hopefully going forward. But I feel like I don't think Mr. Esquivel is ready to vote at this, not ready to score at this point. He wants a meeting with Dr. Webb. I want a meeting with Dr. Webb, so the answer would be we would hold off on that at this point.
Fair.
Okay. The next item for discussion is the contract discussions and review. As per the outline of our last meeting minutes, I think we had discussed having this actually next meeting in our March. Is that correct, Ms. Lesser? Okay. So what I would like to do, and again, keeping everything moving forward, is to make sure that everybody has access to any prior contract negotiation material that they deem necessary to have an appropriate discussion. If there's anything specific, Ms. Lester, that you feel like would be helpful for us that has been previously done, whether it's meeting minutes, whether it's, I did have some material that had shown third-party research discussing the CEO's compensation and the review they had done, both looking at, like, I guess, hospitals and geographies. So I do know that that's available. That data is older, and I don't know what, if any, discussion there would be interest in having some of that updated for at this time, since I think it was back in 2022. So once you have an opportunity to review that information, it may be something we as a committee decide we'd like to get some updates on. But I do think that would be helpful. Anything else from our committee that we would ask Ms. Lester to obtain that comes to mind?
No, if it does, we will let you know.
And we can get Mr. Escobar a copy of the contract too.
I have a copy of the contract. I'd be interested in the compensation, since I think the contract entered in January in 2021. Is that right? Is that when it took effect?
Right.
If I'm doing this from memory, I'm not looking at the contract. But I guess the question is, there are bonuses and other kind of compensation benefits that, my first reading of the contract, kick in based on performance and other criteria. I'd just be interested in the history of that. What has, since the inception of the contract, what, to the extent that there have been bonuses, that there's been, like what the complete compensation picture looks like, just to have a sense of what that has been through the contract.
I can request that from the CFO.
That would be great. Thank you.
Madam Chair, just for some clarification on that note that David just brought up, to me, there's a bit of a disconnect if the assessments haven't been done. I mean, the early assessments were done, evidently. But if an assessment, for instance, for 24 hasn't been done, we're now into 25 fiscal year, then it's hard to relate to whatever bonuses or additional compensation can be afforded to the CEO if the assessment hasn't been done.
I guess as part of my question is that was a bonus paid in the absence of an assessment, and what was that? And then that might lead to more questions about how that was done. But just understanding, given that there's some of that is built into the structure of the contract, I'm just interested in the history, basically, of how the contract has been performed.
We have the complete history.
Hold on just a second. Let me just recognize, give
Donna
your,
Wolford, sorry.
yeah, your name and title,
I'm
please.
Chief Human Resource Officer. We have the complete history. There was a year there where no evaluation was done. So then we had to take it out to legal because it's a responsibility if the board did not complete the evaluation according to the contract, that he had a right to have an evaluation. So we have the entire history of his time being here and the contracts, the compensation. It's unfortunately, as the board has described, it has been a lagging review and a lagging reverse compensation. But the language within the contract, as you'll see, is similar to previous contract years, where there's a portion that he gets the same as everyone else, and then there's a potential for him to earn a certain amount. Whether previous contracts it might have been 10%, this last contract it was 5%. But we do have, and there were third party as well compensation review as well of 1 year where we had to go outside because no evaluation was done for a 2-year period, and then the board felt that was on their responsibility, that they needed to just make it up by going ahead and giving him a compensation for that, for the fact that no eval was done. But that was early in his tenure here. He's been here now 10 years. So we have the full history, if you would like to review it, is what I'm saying.
I think so.
Okay.
Yeah,
And
I'm
we
interested.
have no problem, because we've been gathering
And
it,
maybe
so.
there'll be further questions, because I think I heard you say that at some point when the board didn't perform an evaluation, the board decided to have a third party come in and perform that function. Did I hear that right? No. Okay.
No. Based on contract, we had an outside legal entity review whether or not there was a responsibility based on his contract, because he did not get the evaluation that was held against him, so he could not get the compensation. And so
Right.
they created a whole legal document, and they did the review, and they came forward and said it was the responsibility of the board to complete this review. It was not done. You cannot penalize the person that was supposed to be afforded that. So we do have that.
Yeah, okay, so that history would be really,
Yes.
really important, not
Yes.
important, but it would be useful to me to know how it has been performed.
So, yes, oh, no, absolutely. It's been a lagging, as the chair has described, it has been a lagging review that this committee would like to remedy.
Thank you. Derek?
I'll take another look at the contract, but my recollection of the current contract, distinguishing between salary increases, those are not based on performance evaluation. Right. Those are based only upon what Metro's budgeting process affords Metro employees and hospital authority employees. The purpose of the performance evaluation specific to the contract bonus criteria is for an award of a bonus that doesn't then get added to salary. Some prior contracts may have had a different way of doing that, in that it wasn't a bonus necessarily. The performance evaluation was tied to salary increases. But that current contract is different, so those prior agreements that expired may have had different functions. I will say this, though. It's my understanding you currently are evaluating or going to be evaluating performance for fiscal year 24 and setting criteria for fiscal year 25. Obviously, he's already received or should have received, and it'll bear out in the CFO's report, he should have already received a salary increase effective July 1 based on what cost of living increases that Metro received. You'll be evaluating that fiscal year for the function of his bonus.
Right, understood.
That is correct.
And
Yeah, and maybe, I'm sorry.
go ahead.
Well, it may just be background, but as I recall, there's also a match of a retirement that is listed in the contract as a match, and then a different payment towards an annuity that is also a retirement-related benefit. This might be neither here nor there, but to get a total understanding of what the compensation package is, that's part of the history would be helpful.
I think so. I appreciate everybody's comments, so thank you for that. On page 2 of the contract with Dr. Webb, it actually states effective July 1st, 2022. His tenure started, it's in January 2015, and this obviously runs through June 30th of 2025. It does state in Part 3B that what Derek said is correct. Legally, he receives the cost of living raises, and then in Part C discusses the 5% of discretionary, so that is accurate. But I think having that historical knowledge and helping us to better understand that would be helpful to the committee. Anything else that you feel like would be helpful as we look at the contract negotiations, discussions, review going forward?
It's dangerous I could always like more information. So I don't know if part of the comprehensive history would be self-evaluations that the CEO has done over time. It'd be helpful for me to go tracing back years as to what the self-evaluation, and before we got into this period of a lapse in the boards, whatever is documented as to the board's evaluation going back to what Dr. Webb began would be, again, by his background, just very helpful to understand the whole picture.
So,
And Janet has all those records. They're all recorded.
Great.
yeah, we've got that information. Mr. Lester, anything further?
Well, now I think, given those, I think are very important for all of us, the questions you've asked and the information you're asking for, I think now we have to think about process. How do we move forward to make sure that we are in the best position prior to July 1st, so that the incumbent CEO knows what his position is, and if in fact there is any change, that we know what that is prior to July 1st. So it seems to me that we have to get moving in a fairly quick and efficient manner to gather up all this information and make a determination as to how we want to move forward, whether we want to bring in a consultant to help us determine what we have now, also to determine what it is not inappropriate, in my experience, in boards and in corporate life, to take a look at, what's out there. What are we trying to do? Where are we trying to go? And what is the best person to lead us through that? That may be Dr. Webb, it may not be Dr. Webb. How do we define that? How do we ensure that we are moving appropriately with the right leadership for what the board's policy has recommended moving forward for this hospital?
I mean, in terms of the timeline, I agree with you that a lot needs to happen in a short period of time, because the agreement expires July 30th, I think. And
June 30th.
June 30th.
We've got less than 6 months.
And there's a provision that says within 90 days of June 30th, the parties will decide how they want to restructure the agreement, whether there's going to be any amendments. So I had, in my first read of the agreement, and again, I appreciate your saying I'm not serving as counsel in any capacity, though I'm a lawyer. I'm functioning solely as a board member. But in my reading of the agreement, I noted March 30th as an important date, because that's the date by which, we need to have, as I read it, some conceptual understanding of any amendments or any changes or something that we're going to do different going forward. So yes, within the next 2 months, a lot has to happen.
Janet, sorry, Ms. Lester. Can you tell me, historically, have we used a third party with regard to when we went out to search, and who that would be? I'm just curious.
We used a third party to help with compensation to determine how he rated versus other hospitals or other CEOs equivalent at one point, and I can send you that documentation. I cannot remember the name of it. It's like I could see it.
The individual that, or company we used to, before we got Dr.
Paramount. Oh, you're asking about even
A CEO search, yes.
yeah, we used B.E. Smith,
B.E. Smith,
which is AMN right now.
AMM,
AMN.
AMN,
Yeah,
okay.
they're AMN/B.E. Smith.
Okay.
They come with a wonderful guarantee of a year, so it's a good search firm. So
How did we find them, and did we go through an RFP process with that firm?
At the time, the board chair elected to use that firm, and so
And who was that board chair?
not Dr. Brandis, it was Mary Buffwick.
Okay, so she selected the company, so it wouldn't go through RFP or any kind of a, okay. And,
Confirm that with council.
yeah, we would like to, go ahead.
Can we confirm
Can we confirm
whether or not the chair can make that decision?
yeah, is that available to this position? Legally speaking,
A search firm for a CEO?
yes.
Or
Potentially.
potentially. Search firms themselves usually are obtained through an RFP, but you as a board would have to meet and determine that you want to request and approve the commencement of that process. I don't think this committee can do it.
Right.
you can bring it as a recommendation to the full board, but the full board would have to approve that. And yes, I do believe it's, I'm going through my mind that memo that was prepared about exceptions to the state laws on procurement, and I don't think this qualifies as a professional services contract akin to with accountants, lawyers, or physicians. This is a search firm.
Right. We're not presuming anything. We just want to make sure we know what the entire range of options
I understand.
is for this board.
Sure. I will also say, though, that sometimes there are existing contracts for search firms. And so those initials and acronyms you used a moment ago, I'm trying to recall if any of those are currently, or the one, AMN, is currently under contract with Metro or not. That could shorten the process, but absent someone being under contract, you'd likely have to solicit a bid and proposals with a new search firm.
Well, I mean, it may not go down that path, but just so that we know what our options are.
Correct.
So for clarification as well, that is a firm that the organization had used in the past, so she chose to go with that. So she did not do the RFP process because we had used them in the past. Now, B.E. Smith was alone. They were not merged with AMN at the time, but as you probably realize with search firms, they broaden their scope by merging together. So we do have a current contract on the books for this firm, but that you're not required to use them if you choose not to.
Just so I'm clear, Derek, so the contract has to be with Metro?
Not if the hospital.
The hospital already has a
If
contract.
the hospital has an existing contract, you could rely on it. If Metro has a contract, there's the potential for piggybacking on that contract.
Without going to RFP.
Correct.
Is there a way to obtain that information? What search firms have contracts already?
The information of what search firms are available through Metro should be able to be obtained through its procurement standards office,
Okay.
the purchasing division of Metro.
Yeah.
As far as what the hospital has, your purchasing division should have that information about, and I would recommend reviewing that contract to see if it has expired or not, and things of that nature.
Can you get us a copy of that contract, Ms. Lester? Okay, good. Again, I think we're just talking hypotheticals. We're trying to figure out what our options are. I think it's good for us to have these discussions because of the pending time frame and the fairness to all associates involved. So appreciate your help in the background and also obtaining this information. Anything further for our committee today? There's a lot. So a lot to be done in a very little time. And so I appreciate everybody.
Madam Chair, do we need to set some dates and have those in concrete? So we can always cancel them, but at least to have a series of dates prior to that end of March.
We have another February date and a March date already, I believe. It should be in the minutes. But do you feel like we need more than once a month is the question?
We might as it approaches March.
Okay. Okay. Craig, my time is your time. And everybody's here. So,
Okay.
David, what are your thoughts about increasing the number of meetings between now and then? I mean, we can absolutely do it. Do I think the workload is there? Yes. Quite frankly, I do believe the workload's there. But the question is we obviously have to have a quorum. We had to wait 15 minutes, 20 minutes today to get going. So I just want to make sure that we're all on board.
And if there's a better time for members of the committee,
Sure.
put that out there.
Well, Dr. Fagans, I think, had a last-minute emergency come up with her work, so.
It does seem like with the amount of work that having 2 meetings scheduled may not be enough. I think that if we have clearly defined expectations of the homework we need to do before the next meeting, we could make really productive use of our time. So if we scheduled a meeting 2 weeks from now and we understood what it is that each of us should be prepared to review and talk about, I think that would probably be helpful. Yeah, and I certainly, I mean, don't mind meeting as many times as we are required to meet to do this the right way.
Okay, the current next meeting is February the 11th. So if we pushed up 2 weeks, that would be the week of the 20th, I think. Let's see.
The 20th is a holiday,
Sorry.
and the 21st, we have another committee meeting, potentially. It's two different groups, so we could probably do it back to back.
I don't think they would occur simultaneously, though, correct?
I can't.
The 21st or the 22nd? Whatever. Are we talking about the same time frame at noon? What time is the other meeting?
We haven't
Ms. Lester?
said that yet. We're waiting to hear back from Dr. Hudson that she can actually make that 21st, but the other two have agreed. The other two are in the room.
Okay.
So maybe
do
we
you
should
wanna
do that one first. So
Okay.
maybe we should do the other committee first before this one, because this one could take more time.
Okay, so the
Will definitely take more
21st
time.
at noon, is that, does that work for
That
everybody?
works for my schedule.
Okay,
yes.
great. Yeah, same.
Janet, you put that out.
I sure will. Yes, sir.
Okay, all right, and do we want to go ahead and set another February meeting then?
We can always cancel it.
Okay,
It would need to be after the 11th, towards the end of February, because I am gone the first half of February, or
Oh, no.
the first week. And
Did you ask
holidays.
permission?
I asked Mickey Mouse. He invited me and my children.
When will you be back?
I will be back for the meeting that we have already scheduled on the 11th, so something after that would be great.
February the 11th.
So we have the 11th already, so do we, and then we're gonna have the full board the week of the 24th. So is there something the week of the 17th that we need to look at? Like maybe towards,
The latter part, maybe a Thursday or, nobody likes a Friday meeting, but the 20th or 21st, is that it?
Yep,
Does that work for us?
either one.
now technically the 20th, I'm pretty slammed trying to get everything posted for the full board.
Okay.
So the 21st, even though it is a Friday, if we could do that morning or lunch,
21st.
that's just selfish reasons because I have so much time.
Will you,
The 21st is good for me. I will say, just because I wasn't part of the committee before, February 11th, I have a conflict, just for, so that the committee is aware for quorum purposes, that I can't change a
is
deposition.
it the time or the day?
It's the full day I'm in a deposition that I won't be able to reschedule.
It's
So,
okay.
February 11th.
February 11th, but that's,
Could we
throw
do
that
the
out
12th?
there.
Could we do February 12th?
For my purposes, if we move the February 11th to the 12th, I could attend.
Works for me.
Does everyone agree? Okay, so Dr. Fagans is the only one we haven't asked, but.
All
we would
this,
have-
right, subject to Dr. Fagans, and if that doesn't work, then there are other times that week, it's just the 11th that I have a conflict with.
And you're okay with noon as well?
And noon is fine.
Was the second meeting scheduled for January?
Yes, the January the 21st, I think. we
Yeah, so we've got the 21st of January, February 12th,
We're moving the 11th to the 12th, correct?
correct, and then the 21st of February, and then we've got our March scheduled,
Which is March 17th.
correct. Okay. Sounds good. Appreciate everybody's time. Thank you for doing that. We'll get out a list of homework and expectations for the next meeting, but thank you. Anything further? If not, entertain a motion to adjourn. Thank you.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.